I'm excited to introduce you to, and that is Andrew Scott. It's interesting, Andrew and I had just met for the very first time. He started with the organization at 19. So I want to guess that was like 3 years ago?
Yeah, 3.5.
Tell me a little bit about who you are, what your organization does, and what your goals are.
I joined at 19. I'm from Northern Ireland originally, Chuck, which you probably picked up.
Picked up the accent just a little bit.
Yeah.
Yes.
So I joined when I was 19, our training program on board one of our ships, and then came back home, did some theological training, and pastored for a while in the church before joining the organization again. Yeah. I currently serve as the president of
I should mention I didn't mention the name of the organization.
Okay, Operation Mobilization.
Sorry.
Or OM
My
for
bad.
short. Yeah, no problem. So I'm the current president and CEO of OM here in the US, and I sit on the global leadership team as well.
So what is the mission of the organization?
Well, we believe that when a vibrant group of Jesus followers exist in a community, everything changes, right? And so we want to see vibrant communities of Jesus followers everywhere. That's really our desire. Some people would call that a church. A church can conjure up many pictures in people's minds, so we are sticking to this idea of a vibrant community. People living their faith out in the society where they exist, speaking the gospel out, living the gospel out, doing good, living for the good of the city, and bringing Jesus to those places. We want to see those everywhere, and so our focus is in the parts of the world where Jesus is not known, the places that we would call unreached.
Right. For example?
Places like North Africa, Central Asia, the Middle East, Southeast Asia.
Yeah. How are you able to get into some of those countries? Because some that you mentioned may not be friendly.
You know, you bring up a great point, Chuck, because the reality is 20, 30, 40 years ago, some of those countries you could actually get a missionary visa to get into those countries, right? Believe it or not, right? But the world has changed dramatically, and so you can't get in there any longer with that, or even perpetual tourist visas. So we are seeking to see, in many ways, a change in the mission model moving forward for lots of different reasons. But seeing people going in jobs, you know, not just as a way to access that country. So, for example, going in as a doctor, going in as an engineer, going in as a nurse or a hairdresser, but not simply so that they can get in, but that as they go in, they have a presence that makes sense in that community. They're working for the good of the community. They're bringing good to the community, not just with their words, but with their life as well. And we believe this is a much more holistic representation of the gospel anyway. Yeah. And as you go in that way, there are very few countries that will close the door if you're coming in to bring good to them.
Yeah. So that's kind of your mission is connected in some, I mean, here we are at the Mobilizing Medical Missions Conference. You don't, like me, you don't really have a medical background either, but yet your mission, your ministry is really connected in the medical field.
Well, right? we embrace, in a sense, any vocation. If medical professionals basically hold the key to get into any country in the world.
Right. If you can go into a country and you can help them medically, you can help their children, you can help their women, you can help whatever, then that's the, of course, they would be foolish not to allow that.
Yeah. So we there are literally tens of thousands of opportunities around the world in hospitals where medical professionals can go in and serve in those hospitals.
Yeah. Dr. Alan Sawyer, who is with Samaritan's Purse, is also with us here at the what we're calling Mission Control here in the lobby at Lakewood Church. Dr. Sawyer, I'm sure you've seen exactly what we're talking about here, right?
Well, I've said often that the ministry of medicine allows us to get into places where the gospel would otherwise not be welcome. Yeah. And it just opens doors for the gospel.
Absolutely.
Do you have some stories? Like, I obviously want to be cautious, but do you have some situations that you can share and talk about where doors that were opened that otherwise wouldn't have been opened?
Well, even in a disaster response in Saipan in November 2018, they weren't really interested in having a whole bunch of people come in there and help, but when they found out that we were medical people and coming in and helping, they just opened the doors for us. And because it was a U.S. territory, we actually had to get licensure but they expedited the licensure for the doctors and nurses and made it happen. And we were able to minister to a very underserved people group. But we had priority because of our medical backgrounds.
Yeah. Andrew, I want to go back to you. Operation Mobilization. What's the foundation of what your organization does? Is your mission to connect this ministry, this person to this person? A little bit of both?
Probably a little bit of both.
Yeah.
But as I said before, we want to see vibrant communities of Jesus followers established. So living out their faith, bringing the gospel of Jesus Christ, both in word and deed, in these communities where Jesus is not known. We believe that that's going to be most effectively done when local people are doing it, right?
Okay.
So a lot of what we're doing is trying to train up local people within their context, where there is a local church or where there are local believers. Or if there's not local believers, then people that are nearby.
How do those invitations come to you to come in and help train?
We have thousands of people all over the world, so we're constantly building relationships in that way. So we're going into these hard places to meet these folks, and so we have a very, very big network around the world where that's happening.
Yeah. You said something earlier. Our existing mission models will not work in the coming generation. What do you mean by that?
Yeah, well, the world is changing dramatically. The speed of change is only increasing. And the reality is so many of our models that we've been using, both in church and mission, haven't changed so quickly.
Well, and even to your point, just a few years ago, that you could get a missionary visa. That's a big change.
Absolutely.
That doesn't happen anymore. So that's one example.
Well, I think we have a generation rising up that's saying they want to live out their job, the vocation, for a greater cause. They don't have the secular divide that I was brought up under, which is a good thing that they don't have that. That's changing. I think the church in the global south, the church in places like Latin America, Southern Africa, India, China, is rising now to the fore, and the models that we've built in the West don't fit them. So I think there's a lot of change needs to come. That doesn't mean what we did in the past wasn't good.
Right.
It was wonderful.
Right.
But these models were built for a different era.
Yeah.
And so we have to think of what are the ways we need to reach the people of the world with the gospel of Jesus Christ today.
We're not sending cassette tapes all over the world anymore.
Right. That's right.
I mean, to speak my language,
that's right.
It's just true. It's the same message, it's a different method.
Yeah.
And that's true.
So we have to be really careful that we don't think because we have an unchanging message, therefore we should have unchanging methods.
A lot of people think missionaries are only evangelists and Bible teachers. Do you agree with that?
Well, I think everybody can be an evangelist, but the problem is we have seen evangelists as these a few professionals who have left their jobs, raised support, and gone to do it. Whereas I believe every follower of Jesus is on mission with God. And so whether you're a doctor, an engineer, a hairdresser, an electrician, you're on mission with God. And He has created you in such a way to do those things through which you can now reflect His glory through your work, but also through your words, bring Jesus to those people.
And I think the key, and Dr. Sawyer, you can weigh in on this too, I think the key to what you said is the gifts that God has given us. It's all you need. A couple hours ago, Pastor Joel was here with Dr. Osteen, and we were just talking about their differences, you know. I mean, they both grew up under their father and his ministry, and we all know John Osteen was a dynamic preacher of the gospel and fiery and all those things. Joel, more quiet, reserved. Dr. Paul, different gifts, and just even in that moment, I was sitting there, and here we are in this amazing facility, and all of us have a gift that God has given us, and I think sometimes those passions come with that, and sometimes we just have to develop them, and sometimes all of us kind of have to take a step of faith. I mean, here you were at 19 years old saying, I'm going to jump in on this, it was a ship, right?
Yeah.
You got to tell me a little bit more about that.
Let me just comment on what you just said there. I think one of the biggest mistakes that we have made in missions, Chuck, over the last, certainly post-war, was we have said that to do mission it looks like this. You must leave the things you're good at and come
Right.
do this thing we call ministry.
That's
And,
great.
and
Yeah.
that's what missions is about. And what I believe, what we've done is we've taken the very tools that God put in them to reflect His glory and to do ministry off them, we've put the armor of Saul on them and said, this is what you look like when you go out in the mission field. And so I think this is why I celebrate, Dr. Paul saying, recognizing that he's every bit as much on mission with God as a doctor, whether he's doing it here in the US or whether he's doing it on Australia, as his brother is, right?
Yeah.
It's just, because God uses all of us in the way He has made us.
Yeah. Dr. Sawyer, you don't want me operating on you, I promise.
Yeah, that's right.
Well, I was just thinking, I mean, isn't that the body of Christ?
Exactly.
Yeah.
So
Yeah.
we all have a different function,
Yeah.
and we need to use what God's given us to form the body of Christ.
And that's one of the things I love about this particular conference is those of us who are not in the medical profession, don't have that kind of a background, there's still opportunity for us, as you said, Andrew, to literally use the gifts that we have, that God has given us, even in a mission context, whether it's IT or carpentry or, there's a number of things that we can do. So I know that it's not limited to just operating on people, although that certainly is a need. Yeah,
absolutely.
Well, for those that are viewing that want to find out a little bit more about you, I understand, you didn't bring a copy of your book,
I didn't.
but
I don't have it
talk a
with
little
me.
bit about your book, if you would.
Well, a few years back when I was stepping into my role as the president of OM here in the US, one of my workers, one of the leaders of the work came to me and said, Andrew, there'll be no traditional missionaries in the Muslim world within 10 years. He meant the people that would leave their job, raise support, and go live in a sort of covert presence. And I thought, well, that's all we're set up to do, so what does this mean? And it put me in a little bit of a crisis, right? What have I missed? What's different? And on that journey, I started to reform my thinking, or the Lord reformed my thinking along the lines of what we've been talking about. And a book publisher, Moody, heard me talk about this and said, hey, you need to write about this. So Scatter is the name of the book.
Scattered?
Yeah.
Okay.
Go therefore and take your job with you is the subtitle, and there's some over in the booth for those that are with us. They can get a copy, or you can get it on Amazon. But it's basically laying out this idea that every person that was ever created was created in the image of God, to be in relationship with Him and reflect Him back to the world. And He made them a masterpiece, uniquely shaped, with different gifts, different abilities, different passions, different personalities, so that they could reflect Him uniquely back to the world. And if that's true, then every one of us is on mission with God, and you don't need a call for that. So you're not called to the mission of God, you're made for the mission of God. And so I unpack that in my book, Scatter.
Love it.